Hi, welcome to this episode of Patient Education for the Educated Patient. Today we're going to talk about the vaginal birth after C-section calculator. This is going to be very similar to the induction calculator. The induction calculator excluded patients who had a history of a C-section. This calculator will account for patients who've had a history of a C-section. So it will stratify your risk of ending up with another C-section or successfully delivering vaginally having had a history of a C-section. So let's get started. The take-home points for this video will be to learn how to use the MFMU network VBAC calculator for cesarean section risk when undergoing a trial of labor after C-section. And there's actually two calculators. The first one will stratify your risk based on information available to you at the initial prenatal care appointment. And the second one actually has more information that's available to you at the time you are admitted to labor and delivery. And so that additional information, such as your cervical exam, can further tweak your risk of delivering by C-section or chance of delivering vaginally successfully. So here's the reference. This is the paper that we're citing, and this is a publication again from the Maternal Fetal Medicine Unit Network. This was published in 2007 in the journal Obstetrics and Gynecology, also known as the Green Journal. So despite being published in 2007, they based their data on deliveries from 1999 to 2002. You can see from our video introducing the concept of vaginal birth after cesarean section that 1999 through 2002 was a relatively high period of vaginal births after C-section that may influence the validity of this calculator. This paper was based on several deliveries across 8 different labor and delivery units. All the patients had the baby in the head down position. They were a singleton pregnancy, meaning no twins or triplets, and they were all close to full term, being at least 36 weeks and 6 days in gestation. And they were all full term pregnancies at 37 weeks of gestation at least. So the results, overall, there was 11,800 plus patients that underwent a trial of labor after C-section, and they had an overall successful vaginal birth after C-section rate of about 73%. Of these 11,000 plus patients, 7,660 patients had complete data sets that were able to be used in the creation of this calculator. So the good and the bad. If you look at table 2 of this publication, you'll notice that this will talk about the different factors associated with vaginal birth. So when discussing the odds ratio, the higher the odds ratio is an increased risk for vaginal birth, and the lower the odds ratio would decrease the chance of a vaginal birth. So you can see the 3 main variables that decrease the chance of delivering vaginally, and that includes Hispanic race, African American race, and a recurring indication for cesarean delivery. And what that means is they're talking about the indication for your first C-section. If the indication for your first C-section is something that you may experience again, then that's going to lower your chance of delivering vaginally. And what I mean by that is patients who had a C-section because they were in the second stage of labor, they pushed and couldn't push the baby out, or they tried a vacuum-assisted delivery, they tried a forceps-assisted vaginal delivery, and neither of those options worked, well, then that's going to be the highest risk for failing your trial of labor after C-section. So if that happened to you last time, that might happen to you this time, increasing your risk of having a C-section this go around. Another recurring risk is for arrest of dilation. And what that means is you got to 8 centimeters dilated, you stayed there for 2 to 4 hours, couldn't get past 8 centimeters of dilation, and that is a recurring indication for C-section, thus lowering your chance of delivering vaginally this time around. And that can be at any point in the first stage of labor when your cervix stops dilating. 8 centimeters, 4 centimeters, 2 centimeters. For some reason, you just couldn't progress through to the second stage of labor and deliver the baby. Now, non-recurring indications for cesarean actually have better chances of delivering vaginally. This would include reasons like a C-section for twins, a C-section for breech delivery, a C-section for non-reassuring fetal heart tones. These are reasons for a C-section that would have a higher chance of success with your next pregnancy when you're attempting to deliver vaginally. And now the odds ratios for the variables that intuitively increase your chances of delivering vaginally are, of course, previous vaginal deliveries. And if you've had a previous VBAC, a previous successful vaginal birth after C-section, that is going to increase your risk of delivering vaginally this time around. And you can see that here. If you've had a previous vaginal delivery, your odds ratio is 2.4. A previous successful VBAC is even higher at 2.7. So when you look at these different variables on a nomogram, this will help you see visually which ones are the most important. As you can see on the left here at the top, you have your total points, and then the total points translate to the probability of delivering vaginally. The more points you have, the higher the chance of a vaginal delivery after C-section. For example, if you had 50 points, your chance of delivering vaginally is approximately 60%. So the more points you accumulate, the better. So on the left side, this nomogram shows that age, the younger you are, the higher chance of delivering vaginally. The lower your BMI, the higher your chance of delivering vaginally. And like we talked about, African American race, Hispanic race, those will both decrease your chance of delivering vaginally, whereas previous vaginal deliveries would all increase your risk of delivering vaginally. I hope you can understand why conceptually, if you've had a previous VBAC, that should increase your chance of delivering vaginally again. And you can see that here, a previous vaginal delivery, or previous VBAC specifically, is worth about 10 points or so on this nomogram. Now, that's significant because it illustrates that a low BMI is more favorable than previous VBAC and also being young. But being young is also very advantageous when undergoing a trial of labor after C-section. You can see here, patients that are 24 years and younger have a higher chance of delivering vaginally based on that variable alone than patients who've had previous VBACs. So young age, low BMI, previous VBAC, these are all very strongly predictive of patients who are going to deliver vaginally successfully when undergoing a trial of labor after C-section. So the nomogram is just for a visual representation of the different variables. But here you'll see that the calculator is available online and you don't have to draw any lines or tally any points. It's all done for you. The website's right here on the bottom and you just input these variables, you hit calculate, and the risk of C-section and vaginal delivery is calculated for you. Now this is the calculator with all the information available to you at the intake of prenatal care. If you look here and you click on this link, that will bring up these additional variables. And so when you're being admitted to labor and delivery, you can further input this data and get a more accurate result because this will fine-tune and tweak your results to give you a better idea of what your chance of delivering vaginally is or what your risk of C-section is. So that's it. It's fairly straightforward. Like I said, it's very similar to the induction of labor calculator that helps calculate your chance of vaginal delivery and risk of C-section. That one specifically excluded patients who had a history of a cesarean section. And that one also excluded patients who had broke their bag of water. This VBAC calculator is specifically designed for patients who've had a history of a C-section and want to know their approximate risk for delivering by a repeat C-section and their approximate chances of successfully delivering via a vaginal birth after C-section. And again, the calculator has two different versions. The first version tells you what your chances are based on information available to you at the intake of prenatal care. The second version of the calculator fine-tunes that number a little bit based on various data points at the time of admission to labor and delivery. So the more information you have closer to the date of delivery, the more accurate the calculator is going to be because you can feed it more information. So hopefully that helps you determine what best to do for you, this pregnancy, your baby, your future pregnancies. But again, this is not an end-all be-all. This is only meant to add a little bit more information to the grand scheme of things so that you can better understand what you're faced with, so that you can have a better, more educated conversation with your obstetrician so that you don't set yourself up for failure. This risk stratification calculator can help you delineate exactly which risks you want to take for which kind of benefits you hope to sow. So if you have a very high risk of C-section, then a trial of labor after cesarean section may not be a good idea. But if you have a very high chance of delivering vaginally, then you may want to consider taking on the risks of undergoing a trial of labor after C-section. So follow-up videos to this will include an introduction to vaginal birth after C-section, and another video addressing the informed consent when it comes to a trial of labor after C-section or a vaginal birth after C-section. So look for those videos. Until then, stay healthy and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.